In America, there has long been a debate over healthcare that has centered around affordability and accessibility. Missing from this conversation is one critical element: quality of care. This glaring omission has limited choice for consumers while placing a burden on already overworked physicians. It's a system that is unsustainable, inefficient, and doesn't meet the needs of patients.
One of the biggest problems in healthcare today, from both the patient or the consumer's standpoint, as well as the provider or the clinician's standpoint, is there's been an erosion of that doctor-patient relationship. There are so many levels of third-party entities that have come between the patient and the doctor that the fundamentals of what you're trying to achieve when you're taking care of a patient has been compromised. Ultimately, the first do no harm that we all talk about in medicine when we take our oath is really about what does that individual patient need at the moment you're seeing them. But as a clinician, if you're constantly worrying about hitting a certain metric, whether it's a government mandated metric, an insurance company, or your employer's metric, and then you're also being pressured to constantly assembly line these patients through the door, your ability as a provider to actually spend the time that you need with the patient and have that conversation with them is non-existent.
Despite the difficulties posed by our nation's healthcare system, there is hope for consumers seeking improved alternatives to their medical treatment. Known as concierge medicine, it started in the mid-1990s by doctors who were troubled by the lack of quality time they had with patients and the growing concern that many of their patients' needs were not being addressed.
Over the years, concierge medicine has now morphed into something where it's become the ability for the provider and the patient to create a very personalized relationship where the provider knows their patients very well, they have a smaller practice size, there's increased access to the provider to really provide that personalized level of care.
Just south of Los Angeles, in Mission Viejo, California, Kolvita Family Medical Group is serving as a case study for how concierge medicine, when combined with direct primary care, is a proven effective option for people seeking a highly personalized level of care while providing stability in their overall healthcare costs.
Our patients pay a membership fee annually, and under that membership fee, they basically get access to anything that we can do here in our family practice office. And the benefits are widespread, and you're looking at things like having that doctor that's available 24/7. You have that doctor where you can call them, text them, email them at any time and get a response quickly, rather than waiting multiple days to get responses back. You will have the ability to have visits with your doctor that last longer than the 10 to 15 minutes that you hear about at most offices. Most of our patients have 45 minutes to an hour per appointment because we don't have that many patients at that time, so we have the ability to give them as much time as they need. We also have the ability to do house calls. If an elderly patient, say, can't get to the office, we have the ability to go see them at home, which we don't see very much in today's medical plans.
Under our current healthcare system, there's a cost attached to nearly every test. That's not the case at Kolvita Family Medical Group, which offers an array of in-house services, including EKGs, vaccines, injections, common prescription medications for common illnesses, Class 4 laser therapy, and more at no additional cost to their patients.
In traditional healthcare right now, patients are just a number. You'll be lucky to see your provider or talk to your provider. You'll get whoever is the doctor of the day. Clinicians and doctors just don't have the time that they need to spend with the patients. In fact, some of our providers nowadays are being trained not to even sit down when they're in a room with the patient, because when you sit down, you're inviting conversation. Whereas with concierge practice, your panel is smaller. You keep the practice small and intimate, so you have the time, you have the energy, you get to know your patients on a very personal level. Medicine can be tremendously beneficial even if you're not in the office with somebody, if you know your patient.
What truly makes concierge medicine stand out is the personalization offered by practices like Kolvita Family Medical Group, allowing doctors to truly get to know their patients. This builds trust between the patient and physician, and it gives patients the confidence that their medical concerns will be addressed by their physician with care and compassion.
I see a number of different doctors for different conditions. How I first heard about Kolvita Medical was when we became dissatisfied with our current doctor, called another doctor who had treated my partner that we respected, and she immediately gave us Dr. Davis as a good choice. Kolvita is the most efficiently run medical practice that I've ever seen. Everyone in the practice cares for you. Everyone in the practice remembers you and knows you. I think Kolvita Family Medical is a magnificent blend of professional excellence and personal attention.
Given the advantages of concierge medicine over current healthcare insurance, one would expect the costs to be excessive. In fact, they are just the opposite. For a reasonable cost, often less than many annual deductibles, patients and their families can now have the peace of mind and the personalization of their healthcare outside of the restrictions of their health insurance.
As family physicians, we see everything from infants all the way up to, we have 90-year-old patients and everywhere in between. One subgroup would be patients that are young families that have lots of children or multiple family members where they want to have everybody being seen by the same doctor, and they have the ability to make those appointments same day or give calls or get advice when it would just be too difficult for them to get their children out of school and into the office.
It's made a huge difference because we have 4 kids, and so trying to get into the doctor for anything, just regular exams, yearly exams. My older boys that play sports, they need to do their athletics exams. I was able to get those done in one day with Dr. Zeller when they needed them done quickly. So just the convenience and then knowing that you trust both doctors here is just huge for us.
If the events of 2020 have shown us anything, it's that our individual health is more important than ever. With concierge medicine, consumers are given the ability to embrace that philosophy by moving to a system that gives them greater control of their health in cooperation with medical professionals who truly care about each of their patients and take the time to prove it.